joined by Dr. Gerald Harmon. Dr. Harmon is a board-certified family medicine specialist in Pauley Island, South Carolina, practicing family medicine in rural South Carolina for 40 years. He served as SMA's Budget and Finance Committee Chair from 2020 to 2023. He's retired from the U.S. Air Force and the Air National Guard after 35 years, and is also the recovering chairman and president of the American Medical Association. Dr. Harmon and I will be discussing association's approach to medicine and proactive care, a topic Dr. Harmon will tackle in greater detail later this year at SMA's annual scientific assembly, which will be held at the Grandover Resort in Greensboro, North Carolina, October 25th through the 28th. The value of engagement in organized medicine and public health is frequently underappreciated by physicians in many practice settings. Many of us are so focused on our individual practice and patients' worthy goals that we might miss opportunities to impact the community's health. And it is possible to do this while advancing our professional goals and the health of our practices. So Dr. Harmon, it's great to see you again. Let's start by discussing the iceberg that we all kind of see coming, and that is the shortage. America is facing a crisis in healthcare delivery, with 40% of nurses and 20% of doctors planning to retire within the next year. And the shortage extends to other healthcare workers, such as lab techs, radiology techs, and other professionals. The shortage will be exacerbated by an aging population of 64% of the population over age 65 the next 7 years, with an increasing burden of chronic disease. So Dr. Harmon, what do you think associations can do to help solve this problem with the shortage?
Randy, medical associations, organized medicine has to take this head on. We really have to understand that this is not only a crisis for the future, this is a crisis for today. In my local healthcare system and healthcare systems across the nation, we're having to reduce resources, reduce capabilities for the patients, because we don't have enough folks to run the machine, to run the technology, to give the care. With the real reality that nurses and doctors now are retiring from the practice, and the fact that we can't produce enough of them in a quickly enough manner, fast enough manner to fill the gaps of those that are retiring or leaving the professions, we've got a crisis today. In my local hospital system, we've actually had to close the stroke unit, close our heart cath unit, because we don't have technicians. We have doctors, we don't have technicians just to serve and assist the physician. So we have a reduced access to care at times in our smaller community. Not often, but the fact that even can exist today is a real crisis today, and it's going to get worse. The turnover is difficult to understand and make work.
Yeah, and I know my perspective is always the patient's perspective, not being a healthcare provider myself. And we all see it. It's happening in all areas of our country. So I guess it's shocking to think that this is also happening in healthcare, especially considering pre-pandemic, going back to Obamacare, where we've added a lot of people onto the roll. So now you've got a lot more volume and a decreasing amount of workers. That is a scary thought for sure.
Well, Randy, here's the issue too. We can't just gin it up in 60 days or 6 months. It takes a decade to make a nurse, or at least 8 years, 6 to 8 years to make a nurse, and a decade to 14 years to make a physician. So you can't just say, well, let's just produce some more. And then we have the issue of medical school graduates not having graduate medical education, postgraduate medical education opportunities. So when you graduate with a degree, an MD or DO degree, you can't just go into practice. You have to do 3 to 8 years of postgraduate education for whatever specialty you're going to go into. So the workforce issue has to be solved on the front end. We have to come up with new opportunities. And the cost of medical education, both nursing, pharmacy, dental, medical, is, I wouldn't say astronomical, but it's pretty doggone high.
Yeah, and I think to your point, that the pipeline, there's latency, there's time it's going to take now to solve the problem down the road. What are some things that we can do now? So some of the things that I think about as it pertains to associations particularly is mentoring programs. It's going to be really important for physicians today to, and again, this is asking a lot, but to serve as mentors, to assume leadership roles with physician assistants, NPs, and almost really more like a support role to fill the gap now. Does that make sense?
Well, it does. One of the things that when you talk about why can organized medicine, what's the role of that? As you and I know, organized medicine across the spectrum, with rare exception, is having decreasing participation. I think some of our doctors, whether they're in private practice, independent practice, or whether they're in educational training sessions, or large employee groups, even across all spectrums of practice styles, are kind of thinking, well, I'm going to let somebody else worry about this. I'm going to, it's not my problem. There's a little bit here, but I can't address it from my situation because I'm a member of a large medical group or I'm independent practice. I would tell you that all of us, no matter our career state, can help make a difference. But it does take a vehicle, and the vehicle would be organized medicine to be able to get the changes made now. And that's the reason I think this is important, what we can do. And to your point also, if we can understand it from the patient's perspective, the patients don't know when they have to wait 6 weeks for an appointment or 6 weeks for an x-ray or things like that. They just think that the doctors, we need more doctors. We do, but we also need the entire support system to come together. So it's more than just an individual specialty or an individual career path. It is a group effort, to your point.
Yeah, no, I agree. And I think that to kind of build on that, I think that it's probably also important, again, from a patient's perspective, to be more cognizant of being proactive with one's own health, taking better care of yourself. There's probably never been a time, at least in my history, in my life, that's been more important to take care of yourself, to try to stay out of the system as much as possible by being healthier in general. So I think that's sort of why the ACCME, which is the accrediting body for associations, continuing medical education programs, is focused on and driving accredited organizations like ourselves to involve patients in the educational process. Because I think, again, if it's a bandwidth issue, top to bottom, not just physicians, but the entire system, that we start to see associations as a place, not just as a physician's professional association, which we are, but many of us are, but also bringing in the patients and trying to expand our scope. Does that make sense?
It does. And SMA, the Southern Medical Association, is ideally situated to make that one of its niches. It's one of its focuses, because to your point, if we can engage with our patients and get them on board and educate them and then have them part of the educational process, so that when our healthcare providers, our physicians in training, are continuing their medical education, they understand things from the patient's perspective. You and I know that the burden of chronic diseases we alluded to earlier when you introduced the topic, we have folks that are going to be with 2/3 of the patient population in the next 7 years, by the end of this decade, are going to be over 65 with an associated burden of chronic disease. And with age comes chronic disease. And so as you get more and more chronic diseases, they become more complex, more difficult to manage. If we can tell them before they get to be that age, or once they do get to be that age, how they can take care of themselves, reducing weight, increasing exercise, watching their proper diet, we can reduce the burden of chronic disease, their needs for health care, and help be part of the solution. Because I'm not sure we can keep up with an increasing burden at the rate we're dealing with these the chronic disease burden: hypertension, obesity, diabetes, vascular disease, and cancer. Major killers of Americans.
Yeah, that's great. Great point. I think that it's interesting to think about, but education, mentoring, uh, physician leadership and training, these are all things that organized medicine associations do. So look, the call's there. It's time for us to step up and do something about it. Thank you for your time today. I don't want to delve too far into it because, of course, you're going to be talking more about this at the assembly this year. So anybody that's interested in attending and join us for a more in-depth conversation about this topic can certainly register and attend the meeting this year.
Randy, it's a privilege to do this. I feel called to do it. I think many of the physicians and physicians in training members of the SMA feel called to do it. That's why they've joined organized medicine. They've become active in it, and they've become active. And by being active with a group voice, they have more of an impact. They can deal with the regulators, the decision makers. They can do it to some degree with the political structure too. They don't have to become politicians, but they have to have their perspective heard. That of a scientist, that of experienced physicians and physicians in training, at those who make the regulations and those who can resource, whether it's medical education, nursing education, pharmacy education. They can have an impact at that level via the voice of organized medicine. I'm glad to be able to do that and proud to be a member.
Excellent. Yeah, I definitely know that the medical professionals, all of them that I work with through the association, share a deep passion for taking care of people. And so as things change, we're looking for new ways to deal with these types of problems now, but also long term. So thank you for joining today. I really appreciate it. And we'll be seeing you very soon.
Thank you, Randy. My privilege.